Hi there, it's Dr. Scott MacLean, and this is my practice inspiration I want to share with you today. I'm a director at the Seattle Study Club, and I'd like to talk today about understanding the digital workflow. So what I'd like to talk about first is the change in how the digital workflow is really working. It's really a CAD CAP type of environment, so computer-aided design, and then on the other side, computer-aided production. So producing by milling and also printing. So what I'd like to talk first about is the scan. So the scan is typically brought in from an intraoral scanner. So you purchase this scanner, you bring it into your office, and this can be a USB style or also a cart style. And so these are scanned through the patient's mouth and bring an image that you're going to acquire. The acquiring usually happens over the internet. So you'd ship this file back over to your lab. The lab would use their software, which would be DTX Studio or ExoCAD or 3Shape, Dental Wings or Co-Diagnostics. So bringing the file in here enables the data to start to get organized. Then what happens, you could also do a lab bench scan, and we'll talk about how that works in a second. That image would also be brought in to the lab software, and this would be data that they'd be using to process. Or you could bring the information from a CBCT scan, and this would be a DICOM file, and the DICOM file can also be brought in. So a number of different files can be brought forward. You could also bring periapical x-rays, but we're going to focus mostly on these three. Once we have that data, then we're going to do the design. So the design is really creating an STL file. So the STL file is what we're going to really be purchasing from someone or printing or milling. So this is the real commodity that we're looking for. So by designing this file, we could go first to production, for instance, in a local lab or even in your own office, where you're going to take that file and then mill it. So typically, dentists will send this to a lab, and the lab will then take the STL file, make it, and then mill it at this point. The other thing that you could do is so you can create this product consumable. So you can be buying the STL, you can be using the lab to produce this to make a consumable that you're going to then purchase. So for instance, this would be used to make a crown. We could also do a centralized milling. So centralized milling means I might send it to, for instance, Nobel Biocare or Straumann or someone along those lines. And what we would do is send the file, and then they would use their big CAD-CAM designs, so these CC milling machines, to do batch processing of a number of different objects. And so this would be made so they could be sent back to the lab. They could add the porcelain or do whatever they need to do to make that product. So this way they can make things like angulated screw channels and other products that are very sophisticated, that are very hard to create in your own office. Last, we'll look at milling. So you may printing. Last, we're going to look at printing. So with printing, you're going to take a file, an STL file, and then print it out. So it's almost like printing at your home computer. You have to buy ink. Here you'd buy resin, and the resin's added into the reservoir. So this is typically at this point happening at a lab. So this could also happen in your office. So this could be a way that you take some of the ways of making this faster and easier in your own office. So when you're doing this, you're actually going to print maybe a model, and or you may kind of plan to have some type of implant stent to make you have your implants go in a little bit easier. So by doing so, we're able to print right away. Very accurate and very perfect, and so this is what we want, accuracy and precision. So this can also communicate back and forth. For instance, I could make a crown and then take the crown and then put it on a model that's milled, and then use a crown that's printed, casted. So there's a whole bunch of different ways we can use this. So let's look at that input, because dentists get confused here. You can still take your analog impressions, whatever type you want, and move it into a lab bench scanner. Now, some of the lab bench scanners will actually scan the impression, or you may have to pour up the model and scan the pour up of the model. So pour up the cast and then scan the cast, but it'll still go in and become digital right away. Or number two, your digital impression is going to be an STL file. And this STL file looks like a surface file, and you're taking this with your intraoral scanner, and you bring that into the software as we discussed earlier. So we've got all the data in at the lab or in your office or where this is going to happen. Now, what are we going to do with that? So our goal is to make things that we're going to use to treat our patients. So we could, for instance, make a temp shell. And a temp shell is a form of temporary that can be made exactly to fit on your implant after you place the implant. So it's designed after you've placed the implant on your computer, you can then choose to make this milling. So it has to be milled because it's a product that needs to stay in the mouth a long time. So at this point, you can't print these. We could also make something like an ASC crown. So these are very sophisticated in how the channels turn. So you have to have a very sophisticated milling chamber. So these are typically done in a centralized milling factory. Or we could also have it print a template. So the template could be used to fabricate the way to put the implant in. So we put the implant where we want to go, and then we take the temp shell and put it on top of that. We could also make a bite plane, so we can make this in our office. And last, we could also do a digital smile design. So many different ways that I'm not talking about today, but these are some of the things that dentists are doing with this type of technology. Folks, it's all about the STL file. That's really what we're trying to produce. That's what people are selling, buying, selling STL files. They're also selling and buying the final product, but sometimes we're getting in on the digital workflow at different points so that we can make this really work well in our own office. So for example, here's a digital smile design file that we are planning. We can see that the patient needs a little bone grafting. We can see how planning has taken care, and we can start to make something that we can put into the patient's mouth and try it in as a mock-up. And this is something also that can show us where we want to place an implant. So we can take this file and put it into our digital files for planning and know where things go. Or we can go digital workflow for orthodontics. We can see that on this case that the orthodontist wants to intrude the teeth. So you can take a scan, plan this, send it off. I know people are very familiar with this. It's very easy to do, a lot easier for your team. So it's about these STL files. If we look at the file, it's really a surface file, but it's so much easier to do and so pure. And so when you do this, on this particular example, we're going to make a template for implant placement. So we take a DICOM file and we blend these together. So by doing so, we can use some software and then take the DICOM image from the scanner. So I'm using my OP3D scanner to map out the nerves then, to know exactly where the safety factor is. Patients want to be safe when they're doing this. So by looking at the nerves, we can then take the STL file, bring it on top, and mirror the two together. So we're fusing the two. Plan the implants so that they're staying away from the nerves, staying in the bone, and also lining up with some proposed teeth. I didn't put them on here, but we would propose where the teeth are going to go. So we create the template, and this template then is easy to do surgery. So we can see that this allows us to put the implants exactly where we want to go when we're doing the final presentation. So this is really effective and makes it so that it's going to work well for the patient. So one plan also, once we plan that in the software, so in the DTX Implant Studio in this case, we can take that plan and go make a template as I have shown you, or we can also take it and go to an X-Guide machine. So the same plan can do both things so that we can actually guide that implant with our traditional way or guide it by doing dynamic navigated guided. So this is really kind of fun. I find it really kind of useful. So in our office, we actually have a 3D printer. More and more dentists will do this. It's about the time and kind of having someone there to do this that's the problem. So we're going to need to have digital dental assistants actually so that they're trained to do more and more of this, and also to have dental technicians on site and things like that. So bringing the team together with digital. So here we can see this case, we're printing off some models that we're going to make some implant work. So these STLs are placed on a nest and then printed. And so it doesn't take that long to print them now. They're kind of printing in layers and bringing it up. So this is the way the future is going to happen. So if we look at the actual files themselves, these come in. They're STL files that we've purchased, and then we bring them into the printer, and we can produce these the same day if we really want to. And you can see them hanging down. So it prints in layers by a little laser going back and forth. whether you have an SLA printer or a DLP printer. So it gets a little bit not that confusing. It's about resolution and speed. So you can see that these are very quick and very easy ways to produce things. So here's the point. Digital workflows for you, whether you're an oral surgeon or an orthodontist, or whether you're a periodontist, you have a digital workflow that's unique to you. You need to find out how that system is going to work to you. So when you go to purchase this, decide what fits into your practice by knowing the digital workflow, finding out where the components are going to go, and this will make it very easy. So lastly, it's Dr. Scott MacLean, and I'm hoping this is going to help you in your practice. And I just wish you all the best in your digital adventure, because it's time to get going on that, and it's actually a lot of fun. That's my practice inspiration.